really, really important for you to know. These are muscles that can be strengthened, and it is exercise that works. So I will just emphasize that. Now, breathing and voice can obviously be affected by any neuromuscular problem, and it can also be affected by any other acute illness or pulmonary problem. Anyone who's had who's had surgery usually is sent home with an incentive spirometer. You know, the little you suck into it. So what that is, it's an incentive to take a deep breath. That's why they give it to you, because we know that after surgeries, people are less mobile. They have an incision somewhere, and it may hurt to cough. They don't clear and move secretions normally, and so they're more prone to getting pneumonia. Physical decline just associated with normal aging, and certainly can reduce respiratory muscle performance. Chest wall stiffness from any other pulmonary illness, because one has a diagnosis of Parkinson's certainly doesn't mean you can't also have COPD or asthma or some other condition. And so if, in fact, you were someone who smoked most of your life and has emphysema, you have a restrictive airway disease. And so that, coupled with any changes in the rib cage and stiffness in the rib cage, are going to affect breathing and swallowing. We already have mentioned that associated with Parkinson's can be rib cage stiffness and vocal fold stiffness. So the vocal cords as a valve don't work as well to protect the airway. And the breath support may not be adequate to time breathing and swallowing well. Arthritic changes. When I have someone come to me with a voice problem, with or without Parkinson's, and I'm taking a history, and I either look at their medications and I see maybe that they're on a steroid, or they're on, and they tell me that they have arthritis. Arthritis affects joints and can affect cartilage. Our larynx, our voice box, is surrounded by cartilaginous rings. At the back of our vocal folds, we have cartilage that help them move, and those cartilages can also be affected by arthritis, and it can be another factor that makes them stiff. Medications dry the vocal folds. Medications can thin the vocal folds, all affect their functions. And then, of course, this is sort of the big one, over here. You don't do anything all day. Again, Jeff talked about that. Muscles just get weaker and weaker, and then the attempt to strengthen them just becomes harder and harder. So, when Tony Bennett turned 80, somebody asked him, well, how much longer are you going to sing? He said, I'm going to sing as long as I can. I train every day. You know, if I could never use the word exercise, I would, except it comes out of my mouth too quickly to stop it. But I try when I can to substitute the word practice. Because when I think of practice, I think of a skill or something that we maybe incorporate every day into our lives because we want to reach either a higher level of skill or we just want to maintain a skill. And it sort of takes away some of the negative feelings people have maybe about exercise. But anyone that plays an instrument, a trained vocalist, they will practice all of their lives to retain that skill. So again, I want to emphasize to you that even though these muscles may change and have changed because of a disease, they can be strengthened. And you know, I often say to a new patient when I'm prescribing a program and they're looking skeptically at me, honestly, it doesn't matter what I think. I don't really care if you do it or don't do it. I mean, I do because I care about people. But in my mind, how can you not do it? Because in the background is Parkinson's, sneaking around, changing the way muscles are working. Why would you want to wait till you're having symptoms? And in case you don't know what those symptoms are, the speech symptoms are when your spouse is asking you to repeat every other phrase, or when you're choking constantly at meals. So you've already done a little bit of voice aerobics. And how can it help strengthen your voice? Through its emphasis on posture, diaphragmatic breathing and breath support, which are important for sustaining vocalizations and for speech. Vocal quality by using resonant tone exercises that help use our breath support to focus our voice here up in the resonating cavity. I call this the auditorium for our voice. And emphasis on use of the abdominal muscles, those core muscles for balance, for stability, for postural stability. Those muscles important to support our voice on the breath stream going out. All right, so let's do another little voice practice together, all right? If someone next to you is sleeping, you might want to nudge them. All right. So we're going to do 3 sounds. You see them up there. And it's guided, so follow along. Listen first, and then repeat.
We will begin with a warm-up. There will be no music, just our voices. We will say 3 syllables, mwa, mna, and mia. Listen first, and then join me. Mwa. Join me. Mwa.
The energy is moving that way. Check your posture. Make sure you replenish your breath.
The note changes. The syllable changes. The note changes.
Make sure your mouths are open.
The note changes. The note changes. The syllable changes. Note changes.
Check your posture.
The note changes.
Replenish your breath.
Note changes. Just hum.
You sound good. All right, so let's talk a little bit about facial expression. Just as Parkinson's can make big muscles, respiratory muscles, voice muscles, stiffer, smaller, it can also affect facial muscles, making facial muscles less mobile, expression more flat. Why is that important? Because we communicate much, much beyond the words that are coming out of our mouths. We communicate with facial expression, if you're Italian like me, with gestures, with tone of voice. And so if that has all been flattened out, other people may really misperceive our mood, our approachability. This is Elwin. Does he look happy? Not really. He wasn't. This was on our first visit. I videotape all of my patients, either on their first or second visit. And he's a former teacher. He was telling me at the beginning of the interview, he has a diagnosis of Parkinson's and Lewy body, though not sure about and I doesn't really quite understand either of those, how they interface, and was telling me about his concern about memory problems. But mostly I think what I notice is, again, just sort of a lack of approachability in his facial expression. We know that enjoyment increases facial expression when we're talking about things that we enjoy, where we're in a social context with friends. We tend to be more animated. Gestures may emphasize facial expression. Facial expression almost always increases when we're talking about something that we really enjoy, and the evidence is here. I was asking Elwin about his life as a teacher. And he came quite alive. So one of the things that I often reinforce with people when they're doing, again, especially loud treatment, especially for men, who sometimes mix loud with being authoritative, kind of bossy. Loud is really projection. It's using breath support for volume across the room. And tone of voice. So if I had come up here today and I said, I'm happy to be here because this will be really good. I'm really excited to be here. I think most of you would be thinking, ugh, this is going to be a long hour, right? If I said, oh, hi, Ruby, it's really nice to meet you. Do I look like I mean it? If I said, hi, Ruby, hi, it's nice to meet you, right? If you got home today and in the mail you had a letter from IRS saying you owed them $20,000 in back taxes, you might say, wow, I can't believe it. But if you got a letter from the IRS when you got home saying they owed you $20,000, what would you say? Wow, I can't believe it. So body and gestures and movement all enhanced. They're all, again, connected. All right, so let's do another little voice practice. You're going to say 5 vowels. A, E, I, O, U. All right, you all know them. Make sure you exaggerate the movements. And I should add that when I give one of my patients this Songbirds CD, I encourage them to move around with it, bring it to PT, do it with the PT, do it in the car. You don't have to be sitting in one spot. So if anybody feels the urge to get up and move around, you can certainly feel free to do that. Exaggerate the movements because I'll be coming around checking.
We'll be repeating vowel sounds, A, E, I, O, and U. Be sure your mouth, jaw, and tongue are relaxed and feel the support of your breath powering your voice. Ah, join me. Ah, E. He. He. I.
Said you don't have to sit in one spot. You could dance.
I-E-I-O-U. I-E-I-O-U. I
while you're vacuuming, right? Washing the car. I-E-I-O-U. Getting out of the shower. I-E-I-O-U. 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 Happy trails. Better? Okay, oops, okay. So I already mentioned expiratory muscle strength training as great exercise for improving timing of respiration and swallowing. But exercising and strengthening the expiratory muscles obviously can help to support voice and speech because we're always talking on the breath out. Activation of those muscles are what are used by professional singers. It's what's used during singing, again, during speech breathing. All right, so let me say a little bit about speech therapy. Who are those people again that raised their hands? Kind of seem to be over here. What'd you think about it? I didn't do it, so you won't hurt my feelings. Did you like it? Did you benefit from it? I didn't hear you. It worked. How did it work? Okay, so you're louder? Are you still doing anything? Your wife what? Okay, yeah, great. Great, so you're a walking testimonial, huh? All right, so speech therapy, physical therapy, medicine is an art and a science. And I want to emphasize that. The science is important. It's how we advance. It's how we know what is the most appropriate and most beneficial. But there's also some artwork, and that has to do with how good a communicator your healthcare professional is, how good they are at understanding what your particular problem is and what your particular goals are. What are you coming there for? What do you hope to gain? So when we think about speech therapy, I'll talk about that since I'm a speech pathologist, and we talk about what's appropriate treatment needs to address the underlying problems that are common for persons with Parkinson's. That's the muscle stiffness in our vocal folds, our laryngeal muscles and respiratory muscles, changes in the shape of our vocal folds, the difficulty many people have in generating loudness, and the ability to self-monitor speech. So it's a problem that's interestingly kind of unique to people who have voice and speech changes with Parkinson's, the problem that even though their voice has gotten softer, weaker, speech less clear, the person themselves doesn't necessarily realize it or admit it. They're the ones that sort of insist the spouse is actually the one who can't hear very well. And again, some of that is because it's a gradual, kind of sneaky change. So we know from the research within my own field what techniques can be helpful in helping people improve their speech and voice and swallowing function. But honestly, after 30 years of practice, I would say that what really works, what's really successful treatment, is what includes your goals. Whatever you feel will help you achieve what it is you want to achieve. And just as every single person in this room looks different, is different, you come to therapy really in much the same way, with your own interests, with your own attitudes about your voice. That's what we're concerned about, and your own goals. So it's really important, before you undertake any kind of therapy, in my opinion, Jeff can add to this or not, that you really need to know yourself. I've had people come to see me the first time brought by the most well-intentioned spouses. But again, your spouse can't do the work for you. If it's a voice problem, you walk in and out of my office, or I walk in and out of your home, and it's your instrument, it's your larynx. Really, nobody else can do the work for you. And I don't get up in the morning and look at a list of goals that somebody else has written for me of what I need to do for the day. I don't think many of us throughout our lives do that. We set goals for our lives. And so really approaching therapy, I think, has to be done the same way. I kind of broadly think of sort of two categories of patients, not to stereotype people, but I think there's a lot of people who come to therapy to see what they're going to get. And many of them might be disappointed at the end of 30 days because they didn't count on the fact that they were going to have to keep doing something. And then there's people, I think, who come wanting to learn something, wondering what they're going to do. And those folks probably will be the most successful. Some of the fault, I think, is among therapists. I think that over time, therapy sometimes has been presented as some magic. Nothing magical happens. The magic happens when you continue to work the program, like the gentleman in the back, and are proud of your own results. So you really do need to know what you hope to gain. Just because the doctor wrote the script, really, it's kind of like just because your parents are going to pay for you to go to college, but you want to party, save their money. If you don't really want to go to therapy, save Medicare's money, because they're in a lot of it. And maybe it's just not the right time. Maybe it's just not the right time. Maybe you tried therapy and you hated it. Maybe it wasn't the right program. So people are all different. Patients are not all alike. And everybody ultimately may have different goals. So see, these are some of the things my patients have told me. I want better speech. How are we going to know that? How are you going to know that? How will we measure it? I want to talk louder. I want to talk like I used to. It's kind of fun for me sometimes if somebody has a answering machine message from many years ago before their voice changed, and I kind of hear how they sounded. I want to read poetry. Nancy writes and reads poetry. One of the saddest things for her is that she feels she can't show up and do that. I want to lecture. Carlos is a retired physician. Prides himself on his lecturing. Could stand in front of a lecture hall this big without a microphone and lecture. He wants to have that sense of himself again. Doug I met on a cruise, on a Parkinson's cruise. So everybody comes to me with different goals. You're all different. You all have a different notion of what can be improved. So you really need to think about that before you show up. So how prevalent are speech problems in persons with Parkinson's? This year, in 2012, the Parkinson's Alliance and the DBS organization published findings from a study. They had over 500 people respond to the study. And actually, the study was looking at non-motor symptoms associated with Parkinson's. So non-motor symptoms means anything other than the movement problem. Can be sleep disturbances, mood disturbances, and include speech problems are often included in non-motor symptoms. In persons with deep brain stimulation, over here, 217 persons, speech problems was in the top 3 symptoms that they were experiencing, was the top symptom in the top 3, with 96% of those persons reporting speech changes. In persons without DBS, in the older group, so the older group was considered 50